Good morning, everybody. Welcome back. 20 minutes after the hour, 7 o'clock, and we've got Tom Blue on the phone with us this morning, along with Dr. McLean Duncan in this morning from Siskiyou Vital Medicine, along with Jules Duncan as well, of no relation. Make sure we point that out. And then, of course, Tom, it's great to have you in because you were just saying the Chief Strategy Officer for the Academy of Private Physicians, American Academy of Private Physicians, and also facilitating Liberty Direct. And I just want to come right out. Of course, welcome to the program. Thank you so much for your time this morning. Tell our listeners what Liberty Direct is.
Well, Liberty Direct is kind of exciting news for people under 65 that are kind of paying the freight on their own health insurance. It's a government-approved alternative to health insurance that until fairly recently, not a lot of people had ever heard of. And it's a program that is built on the concept of built on the framework of a healthcare cost-sharing program, which, unbeknownst to a lot of us, has been going on for years and years. And as the price of insurance began to skyrocket, through the course of the 2000s, and then we became obligated by law to buy insurance in 2010, when these folks got an exception for healthcare cost sharing, and the prices of those programs really didn't budge over the course of the last 5 years. All of a sudden, they have really, really surfaced to public attention. I mean, they were in the Wall Street Journal last week. And so, what it essentially is a program that enables an enormous nationwide community of kind of health conscious people to share the burden of healthcare expenses with one another, and in doing so, save a great deal of money. And it also eliminates another big problem that a lot of consumers have, which is the narrowing networks that we're all subject to when it comes to choosing our providers. In the world of healthcare cost sharing through Liberty Direct, the concept of a network really doesn't exist. So consumers are free to choose whatever physicians that they would like to have relationships with, I guess the sanctity of that doctor-patient relationship is very well respected in this model.
You know, Tom, it's an amazing concept, and it's fascinating to hear you talk about it. The buzzword is healthcare cost sharing. That is the if folks are listening and they want to do Google searches afterwards, healthcare cost sharing, but it makes it easier if you just get to libertydirect.org and everything is explained right there. Fascinating that the ACA gave you an exemption to continue what you've been doing all along.
Well, it's interesting. It's a religious exemption, and the origins of this practice really date back, like I said, kind of decades in certain Christian communities. And if you think about, in your mind, the Amish, and everybody sort of throwing money into a pot, and someone has a healthcare crisis, and the pot kind of pays the bill. Well, that practice became much more formalized and sort of institutionalized by the late 1900s, and has proven over time to work very, very well and very affordably. It's administered by nonprofit organizations that have much lower overhead, and it's again, when 2010 rolled along, the ACA was passed. Very easily, these folks got a religious exemption, and so the Liberty Direct program is really exciting because it is welcoming to people across all faiths, and so it's non-exclusive in that regard. The common belief structure really is it's a program designed for people that value health and take their health seriously. And as a result, when you aggregate people like that, the risks are much lower and the costs are much lower, and it's something that's proven to work to the benefit of everybody involved. It's really very exciting.
Well, and the rising costs simply aren't there. I mean, the complaint that everyone has is pharmaceuticals are going up, administration is going up, costs are going up, premiums are going up after the first of the year. All these premiums are going up, but yet the shared amount, the monthly shared amount, hasn't changed in 4 years.
That's exactly right. Yeah, it's fascinating and in many ways kind of enlightening to understand that. The way this program is designed and the way it's administered, again, it's run by a 501c3 nonprofit, and there's literally not permitted to simply increase the cost if there's no need for it. They've been very easily paying all the claims that are submitted over this period of time. They've got a very, very reasonable administrative cost of, I believe it's like $24 per household per month. And if you think about it, the cost of healthcare inflation, the cost of a unit of service in healthcare, an MRI or a doctor's visit, hasn't exactly gone through the roof over the last 5 years. But our premiums, on the other hand, have gone absolutely through the roof, as have our deductibles, and as have sort of the narrowing of what it is that we're getting in exchange for this money. So I think it's a much truer reflection of the actual cost of healthcare, and kind of combined with a fairly elegant way of grouping like-minded, health-conscious consumers together, it turns into a very powerful proposition for a lot of people struggling under the weight of healthcare, and frankly struggling as a result to afford actual health and health services.
Well, and here's the next thing is being able to trust the provider that when you need the care, you're going to get the care. Tom, we've got a break we're faced with, but we want to come right back. Ladies and gentlemen, Tom Blue, he's the American Academy Private Physicians. He's the Chief Strategy Director and also helps with, the Program Director for Liberty Direct. LibertyDirect.org is the website. We've got lots more to talk about, and in the studio with us as well, Dr. McLean Duncan with Siskiyou Vital Medicine and Jules Duncan and we're going to be continuing the discussion of what people can do, and it's just fascinating to think here we have a solution-oriented program, and we're going to be talking about direct primary care, all of the above when we come back on the Sunrise Show, News Radio 880 KCMX. Craig Froelich in, and we'll just be back after this. Stay with us.
So get up. Top of the morning to you.
Good morning, everyone. 35 minutes after the hour. Welcome to the Sunrise Show. Craig Froelich in, and continuing with Tom Blue, and he's the Chief Strategy Director. Tom, I didn't get that right. Chief Strategy, the American Academy Private Physicians. Tell me again your official title, I guess.
Yeah, Chief Strategy Officer. You pretty much got it.
Okay, all right, got it. But now for Liberty Direct, do you have a title for that? Have you?
Well, I'm the program director of it.
Okay, good. I had that right. Okay, good deal. Well, this is fascinating. Ladies and gentlemen, libertydirect.org is the website, and it is a fascinating concept. One of the most fascinating is that it was given an exception by the Affordable Care Act to continue as it's been going on for the last 20 years. And Tom, like you described, it basically was continued as a religious exemption, and there were 4 basic religious groups, but three of the 4 were devoutly Christian, but the one that we're utilizing here is kind of based off of the Mennonite model, but that set aside, the whole direct primary care piece and what Liberty Direct can do, and it's this. Once again, this key phrase, healthcare cost sharing, or this monthly shared amount. So get into the money, the nuts and bolts right now, what it costs for a single, a couple, and a family monthly, and how this works so folks can understand that, compare apples to apples on their Affordable Care Act plan that they're being subsidized right now.
Well, I'll use myself as an example. So I've got a healthy family of 5. I live in Virginia, and about a year and a half ago, it was actually around Thanksgiving, a little less than a year and a half ago. I'm reading a book on the self-pay patient because my health insurance premiums, which I'd always been responsible for paying on my own, were at the time like $767 a month, and I had a $12,000 in-network deductible. And, another year was about to go by where I hadn't come within a mile of hitting my deductible.
Oh, my gosh, that's the sick part, yeah.
It's crazy, and then and to add insult to injury, my insurance agent's like, yeah, we're probably going to see another increase of a couple of $100 a month, so I'm going to creep up close to $1,000 a month, and I'm just thinking to myself, this is completely unsustainable.
Oh yeah.
And so anyway, so I'm reading this book and find this chapter on healthcare cost sharing. I did this investigation. joined the Liberty program, and went from paying that $767 and $12,000 in-network deductible to paying today $449 a month with an annual unshared amount, which is in healthcare cost sharing, a very similar construct to a deductible of $1,500. So just a terrific savings, and everybody is sort of at a different starting point, but you can kind of do the math on a family yourself. As an individual adult over 30, the monthly share amount would be $199 a month. The annual unshared amount would be $500 is that threshold. And then for couples, it's $299 a month with an unshared amount of $1,000. So, you can kind of do that math for yourself and sort of calculate what the degree of savings would be. But for most people that are paying even a portion of their own health insurance, it's a considerable savings.
Right. Now, just so we're clear, the family annual unshared amount, once you get to $1,500, there's your premium for the year, whereas you were spending, what was it, $12,000 or so?
$12,000 was my deductible. That's right. And so once you hit $1,500 in shareable medical expenses, everything beyond that point is a shared expense, paid through the program. And so, and the nice thing about it is there's no complexity to it. There's not an in-network and out-of-network benefit as we're accustomed to in the world of insurance. It's just simple. Once you hit that number, then you know that your costs going forward are going to be shared through the program. And so it's just a lot easier for people to understand and a great deal more transparent.
Right. Now, I saw where one of the figures was not everyone is accepted. There's about a 5% that might be accepted with pre-existing condition. So you've got that little issue, but the savings is so drastic. I still don't see where you couldn't benefit from this.
That's right. It is important for people to understand because it's interesting. I've noticed over the last year that in a sense the only real objection that we hear about this program is that it just sounds kind of too good to be true relative to the cost of insurance today. And you made an important point. They have the ability to they've done a few things that allow them to make this a lot less expensive. One is the ability to not accept everyone who applies. So about 3% of people who apply are declined just because of the burden of healthcare cost and disease that they would bring to the program right out of the chute. Now once you're in, you can't be kicked out by law. You can't be kicked out of the program for incurring too many healthcare costs or just on the basis of your health, but they do have the right to decline folks on the way in. So about 3% of people get declined. Another 7% of people are brought in on what they call a provisional basis, which is to say they pay an extra $80 a month. So let's say you have type 2 diabetes and it's out of control. You would be welcomed into the program at a cost of an extra $80 a month, which they then use to hire you a health coach. And once you have essentially restored your health to whatever your target numbers are, then the $80 goes away, and you're a full-fledged member paying the same prices as everyone else. And so there are a couple of things they've done to manage their costs and risks that have had a really profound effect.
Tom, this is really amazing because as direct primary care, the first in Oregon, Siskiyou Vital Medicine has now reached out, and now you're partnered with this. Explain that partnership, because we've got Dr. McLean Duncan in the studio with us. This is fascinating.
Well, I'll tell you, it's fascinating and also really exciting. So one of the things that has been discovered over the last 20 or so years that doctors have been engaging with patients through a membership model. So direct primary care is a different financial relationship between the doctor and the patient, in which the patient more or less joins the practice as they would a health club. So they pay a monthly membership fee, and the membership fees vary depending on the practice and the location, that type of thing. And in exchange for that, they have essentially purchased primary care. And so these practices tend to have a smaller patient panel, so they have more time with the patients that they have. Patients don't have to wait to see their doctor. Appointments are longer. The annual health assessments are more thorough. And for working people, the conveniences of being able to correspond with the doctor by email or by Skype or telemedicine visits are incredibly convenient. These things have become, in many instances, remote clinics for almost like an on-site clinic, but a near-site clinic for employers. And so over time, what's been proven is that when patients join a practice like this and have that type of relationship with a primary care provider, that they actually incur fewer costs. And so the Liberty Direct program, kind of the cherry on top of the program, is that it subsidizes that membership fee. So in the case of Siskiyou Vital Medicine, their base membership at $70 a month for an individual would be reduced by $60 a month by virtue of a subsidy from the Liberty Direct program. So patients, in addition to saving a ton on premiums, would have that membership fee reduced to only $10 a month. And it's a huge win-win. It's a win for the patient, because this model of care is something that is incredibly well liked, and the retention rates in these programs are through the roof. And of course it's a win for the Liberty program because it's well established that people will have fewer costs.
It's amazing. We're going to continue with Dr. McLean Duncan in the studio with Siskiyou Vital Medicine, and we're going to be talking about that whole issue of that relationship between doctor-patient. And I'll tell you, Tom, Americans have been furious over the fact that the federal government will say, if you want your doctor, keep your doctor, and that was a total sham. And everybody kind of bought in on that premise. And had that been said in the beginning, we all know that the ACA simply would not have succeeded.
That's right.
Yeah, it's a shame, but it's great to see that, you're part of a solution rather than part of the problem. And Tom, this is fascinating stuff. We've got a break, we've got to go, and we're kind of out of time, but this is, Tom, fantastic, great job. Ladies and gentlemen, Tom Blue with Liberty Direct. You want to get to their website, libertydirect.org. You want to check all of that out, and then stay tuned, because we've got Dr. McLean Duncan in with Siskiyou Vital Medicine. You want to get to their website as well, siskiyouvitalmedicine.com, and they're working together with Liberty Direct to provide this incredible health net of care. And wow, Tom, this is fascinating. It's, like you said, very exciting.
Well, thank you.
Thanks, Tom. Appreciate the time, and let's be in touch real soon, because this topic is so big, and it's really great, especially when you have people that are suffering so badly in their lives, and everybody's just so stressed out over it. And you think, if you can just get to the doctor, and here's healthcare that really makes sense.
It's a big deal. You're right.
I mean, you've got to be seeing, when you talk to people, their mouths are hanging open, right?
It is. Once people kind of get their arms around the concept, it's incredibly well received. Yeah.
What's interesting, Tom, is when I went onto the Liberty Direct site, I was on there, and only after a few minutes was the little icon down in the bottom right of the screen, and a little chat lady came on and said, "Can I help you with anything?" It was really wonderful. The fact that, you could pop on and ask a question about something, but I didn't need it because the website was so easy to use. But I just want to compliment you and your staff on that whole idea.
Oh, well, thanks. Yeah, it's a considered sort of decision. So we find there's a ton of chatting that goes on during each day, and so it's something people like to investigate and ask their questions. But it's been a really, really exciting thing to introduce.
Very good, very good. Ladies and gentlemen, Tom Blue with Liberty Direct, libertydirect.org. You want to stay tuned, because we've got Dr. McLean Duncan in with Siskiyou Vital Medicine. We got to get to a break. We'll be back more on the Sunrise Show on News Radio 880 KCMX after this. You can find us on the web, kcmxam.com, and we're streaming the show live. So get to that website. All our links are there too. Our Facebook page, our Twitter page, our YouTube page, my email, Craig@radiomedford.com. Back after this break.